For me, community planning is all about working together with our communities and other organisations from the public, private and third sector, really in an effort to deliver a better service to the people that we serve in North Ayrshire. I suppose the biggest difference is that we are no longer trying to meet our targets on our own. Community planning allows us to work with our partners and our communities to share information and resources, working towards shared outcomes. What I found is that we can all achieve a lot more together than we ever could do alone. For example, the Scottish Fire and Rescue Service now have moved into areas we would never have traditionally been involved in before, such as the Violence Against Women Partnership, the Alcohol and Drug Partnership, Tobacco Control Steering Group and Adult Support and Protection. Now, it's recognised that addictions such as alcohol, drugs, smoking, along with domestic abuse and unemployment, for example, are all lifestyle factors which increases a person's risk from fire. So, by working together to try to reduce or eradicate some of these wider social issues, we're also helping to reduce fires and in doing so as well. I think that what community planning has done for the people of North Ayrshire is it's certainly made all the partners who are involved more efficient and effective in the way they go about their business. There has been a reduction on duplication of work because individual organisations are now working together rather than trying to tackle the same problem but from different angles. So it's certainly a lot more coordinated. And it also allows us to identify problems much quicker and resolve them more efficiently. But I suppose one of our most successful examples of partnership working would be our home fire safety visit initiative, which basically involves the fire service going into people's homes, carrying out a risk assessment and offering practical fire safety advice, really to improve the safety of the occupants within that household. However, we realised early on that although we were getting a lots of requests from the members of the public, some of our most at-risk people in the community were a lot more apprehensive about picking up the phone and asking us to come out and visit their houses. So we weren't getting to the people, the hard-to-reach people who we really needed to be getting to. So we found that when we approached our partners, a lot of our partners already had good working relationships with some of these people. I'm thinking of people like care workers, the police, education. So we trained staff, other frontline staff who were dealing on a day-to-day basis with families and individuals who wouldn't necessarily ask for our service, and they were able to then make referrals to ourselves, and we would then carry out joint visits, which have been extremely beneficial. Every good partnership, the partnership working should be a two-way street. So not only do we ask our partners to make referrals for home fire safety visits for us, but we have also trained our staff on a number of new skills, such as suicide prevention, dementia awareness, adult support and protection, and more recently we've also been involved with the falls prevention team with the NHS